let me just go over the guidelines because I'm totally confused. I can't make sense out of anything anymore. Here's the rules that we've always had and I stick by. And I stick by the guidelines that I would give to my daughter, to my wife, to my mother, because that's where I think we should be going from, not how to save money, not how to reduce anxiety, nothing but trying to save lives. And we know that regular screening mammogram saves lives. Nobody's arguing that. What the argument is about is when to start, how often to do it, and when to stop. So for average risk women, the standard guidelines have always been start at 40, do it yearly, continue yearly until you reach the age where you have overwhelming medical problems and you don't, that takes precedent. You can stop doing yearly mammograms at that time. We've had recommendations to start at 40, 45, 50, go every other year, stop at 74. All these things are arbitrary, and interestingly enough, they're all based on a very flawed study from Canada that indicated that mammograms cause more problems than they solve. They actually concluded that if you don't have a mammogram, your chance for survival was better. It was interesting how they came to this conclusion. They looked at thousands of women, and any woman who entered the study that had a big lump went into the mammogram study, and those that had a normal exam were given the option to go into the screening study that didn't get the mammogram. And as it turned out, all these women that in the mammogram study, they had a higher chance of dying. It didn't work. So the point is, if you don't do a study that's credible, you're going to get flawed results. Recent studies from Canada where they used modern equipment and they distributed the women evenly showed a 30 to 40% improvement in survival, women, including women under age 50. So if you want to save lives, if you want to catch cancer early, if you want to avoid the need for chemotherapy or for aggressive surgery, you want to save your breast, then start mammograms at age 40 and continue it yearly. Now there are high-risk women where we start earlier. Women like Angelina Jolie, where she was tested positive for the BRCA gene, we're going to start at age 30. We hate to do mammography much earlier than that because the breasts in a younger age are more vulnerable to damage from radiation, just like is the case with the cell phone situation. So we start those women at age 30 and do it yearly. We start those women with MRIs at age 25. So I think the data is overwhelming. This issue about the mammograms causing a lot of anxiety or leading to biopsies that prove not to be cancer, yeah, that's part of it. We don't have the perfect test. We're making real progress, though, by adding ultrasound in women with breast dense or MRI in high-risk women. We're now picking up a lot of the cancers that are missed on the mammogram. The new techniques of tomosynthesis, which is a 3D mammogram, have cut way down on the unnecessary biopsies. So what we really need to do is invest in research and come up with better screening tests that have fewer false positives and catch smaller and smaller cancers. And we can wipe breast cancer off the face of the earth as a killer. It's just a disease that we have to catch early and treat.